Good afternoon, everyone. My name is Pierre Noel, and I'm the Executive Director of the Haiti Development Institute, an initiative of the Boston Foundation. HDI exists to build communities, and by supporting local leaders, strengthening organizations, and connecting stakeholders for systemic impact. To that end, we work to build capacity and credibility in grassroots organizations. We serve as a philanthropic intermediary and advisory capacity as well. And lastly, we serve as a civic leader and convener, bringing stakeholders together across sectoral boundaries to promote learning, collaboration, and increase impact. So it is in this vein that we are actually convening this call today. The objective really for us on this call is to create a platform to inform about COVID in Haiti, its impact, and the planned response. Hopefully, we're looking to invite alignment and find appropriate opportunities as also for collaboration and support, which we believe should lead for more strategic and equitable response that is worthy of our beloved Haiti. Having said that, I want to particularly thank our esteemed panelists who have agreed to join us. I know that at this time right now, your time is very much invaluable considering and in demand right now, considering how things are ramping up in the country right now. So I'm grateful and we'll look forward to having a very informative conversation. Just want to say, go over a few housekeeping matters as well before we get started. As I want everybody, for purpose of being able to share and continue learning, this webinar is being recorded. And also, we do expect to have substantive time for Q&A to really give us a good and engaged conversation. We have solicited some questions in advance, and in fact, some of you, as you registered, have actually shared with us some of your questions and concerns that you want to raise with the panelists. So I again want to say thank you to our panelists, and I also want to turn it over at this time to our moderator for this conversation, Ryan Gia. Thank you, Ryan, for agreeing to moderate this conversation for us. I know this is, again, another demand on your time today.
The second, which is stated a little bit more softly, was that
we're very much grateful for your time, Ryan. I want to reintroduce Ryan, say a little bit about Ryan before I turn it over to him. Ryan Gia is currently a program officer for Haiti, Latin America, and Caribbean program at the W.K. Kellogg Foundation in Battle Creek, Michigan. In this role, he works in the foundation's priority place of Haiti to support thriving children, working families, and equitable communities. Additionally, Ryan provides leadership oversight of the design and execution of complex, community-driven, multi-sectoral, private-public strategic partnerships and initiatives aimed at improving health of mothers and children in Haiti. Prior to joining the foundation, Ryan served a variety of roles with Partners in Health, during which time he oversaw a number of public health portfolios. Mr. Gia received his bachelor's degree in applied economics with a minor in global public health from the University of Virginia and a master of health in health administration from Tulane University School of Public Health and Tropical Medicine. He also holds several professional certifications from public health institutions in the US, including Global Health Delivery Intensive from the Harvard Chan School of Public Health. So he is very well versed in the content of the hour and experience in that content as well in Haiti. And again, thank you, Ryan, for agreeing to lead us and moderate this panel. Ryan?
Hi, Pierre. Thank you so much, Pierre. Good afternoon, friends and colleagues. I hope you, your family, and friends are doing well during these extremely challenging times. As Pierre Noel just mentioned, my name is Ryan Gia, and I was born and raised in Haiti, and I currently lead the health equity work for Haiti at the W.K. Kellogg Foundation. It is my distinct pleasure to moderate this great panel along with HDI this evening. Thank you to all of you for your participation and interest in learning more about the impact of COVID-19 in Haiti. For those of us living in the US and who have been following the situation in Haiti, it has been very catastrophic to witness the trajectory of this global pandemic over the last 3 months. In the US, states are struggling to reopen, while the number of lives lost because of COVID have just surpassed 100,000. So my deepest condolences go to those who have suffered tremendously because of COVID, and especially to those who have lost family and friends to the virus. Just yesterday, the WHO said that Latin America has now become the center of the global pandemic. But as the crisis continues to grow in Latin America and the Caribbean region, far from the world's view, parts of Brazil, Peru, and Ecuador are now devastated the way Madrid, New York, and Paris were, but with fewer resources and less of the world's attention. Governments in these countries either can't or won't offer a full tally of the dead and are severely undercounting the number of COVID-19 casualties. And often a correction multiplier is needed to get accurate statistics. Those unaccounted for are often amongst the poorest of the poor, since this virus has shown a particular affinity for the most vulnerable in society, as the US experience clearly demonstrated. In Haiti, the number of new reported cases is increasing rapidly. Haiti has now passed 1,000 confirmed cases of COVID-19, just a tenfold increase from just 2 weeks ago. While severely undercounted because of limited testing capacity, global health experts predict that Haiti is now at the bottom of the curve and that there currently exists mini outbreaks all over the country and that community spread of the virus is rapidly accelerating. Global health experts are extremely worried about Haiti as the crisis continues to unfold, and projections show that COVID-19 could impact as much as 35% of the total population, requiring between 8,000 to 10,000 functional hospital beds for the country to cope. It currently only has less than 200 hospital beds designated for treating COVID-19. So we have a full packed agenda for you this evening, and it is my great honor to be introducing the panelists. We'll begin by learning more about the work of the National Response Task Force, why it was formed, why it is structured, financed, and its role in leading the national response against COVID-19 in Haiti. First, we'll watch a brief video from Dr. Jean Pape, also known as Bill Pape, one of the most respected Haitian scientists and the Howard and Carol Holtzman Professor in Clinical Medicine at Weill Cornell Medical College. Dr. Pape is the founder and director of GESCO, and he has been recently appointed by the President of Haiti as co-chair of the National Task Force for Responding to COVID-19. Next, we'll hear from Mr. Paul Auxila, Controller General of the National Task Force and consultant for the World Bank attached to the Ministry of Health in Haiti. Finally, we'll get to hear from leaders of 2 local grassroots organizations responding to the crisis on the ground and are facing challenges in implementing the standard public health approach to outbreak containment, the prevention, testing, and treatment. First, we'll hear from Dr. Vanessa Ouzier, currently serves as Chief of Pediatrics and Nutrition at GESCO Centers. And in addition to providing clinical care, Vanessa conducts research and is the site coordinator for the NIH-funded International Maternal Pediatrics Adolescent AIDS Clinical Trial, so-called IMPACT, at GESCO. Dr. Ouzier trained at McGill University in Montreal, Canada, in pediatrics and in pediatric infectious diseases. Then we'll hear from Dr. Inobel Pierre, Director General of St. Boniface Hospital, run by Health Equity International in Fond-des-Blancs, one of the few referral hospitals in Haiti currently equipped to receive COVID-19 cases. Dr. Pierre earned his medical degree from Public Medical School in Port-au-Prince in 1998, and is a pediatrician who first came to St. Boniface Hospital in October 2002. He's a member of the Haitian Academy of Pediatrics. I will transfer that to one of our hosts so that we can quickly listen and view Dr. Pap's video. Thank you.
Brothers and sisters from the homeland of Haiti, I salute you. My name is Bill Pap. I'm Director of Gaitskeu Centers in Port-au-Prince, Haiti. I'm also Professor of Medicine at Weill Cornell Medical College in New York. For the past 4 weeks, I've been wearing a third hat, that of co-president of the Commission fighting COVID-19 in Haiti. It is in the name of the Commission that I'm talking to you today. Our country, Haiti, is facing 5 major problems. The very first one is political. At a time when we should all be united against a common enemy, our country is divided. The enemy itself, the virus, doesn't know any difference about colors, economic status, or political preference. The second problem we have is security. As you may know, the security situation has been getting worse. How are we going to provide prevention messages against this virus in populated slums that are controlled by gangs? The third issue, and that's perhaps the most important, is economic. As you know, we are the poorest country in the region. Last year, the country was locked for 6 months. That affected the economy, but the pandemic has made it much worse for 3 reasons. First, the transfer from the diaspora has decreased by 30%. The second source of hard currency, the export factories, were closed for 4 weeks and have reopened at 1/3 of their capacity. The third source of hard currency, tourism, is dead. As a result, we have passed the bar of $1 for 100 goats, and this is likely to get worse. The fourth problem is food supply. As you may know, in a normal situation, we have 40% of Haitians who require food support. This is also going to get worse because the cost of food is going to be higher, not only because of the inflation, but also because of the drought that we had this year that will reduce crop production. The pandemic of COVID-19 is coming to Haiti. It is coming also at a time when we'll have to fight it alone. Why? Because our friends, our foreign friends, have left the country. We'll have to fight it alone also because the friends of Haiti are not providing any support. They are busy taking care of their own people. So this time, really, we are alone. All the expenses that have been done thus far have been done by the government through the Treasury and also by the private sector. I take this opportunity to thank the Haitian private sector, who's been very generous in their support. Now, we'll need your support as well, because the cost of equipment to protect medical staff so that they can take care of patients without becoming infected is very expensive. The cost of oxygen generators that will produce life-saving oxygen is expensive. The cost of autoclaves to disinfect products is also expensive. My brothers and sisters from Haiti and from the diaspora, I promise you two things. We will do all we can to save as many lives as possible with the limited means that we have. We'll also make sure that every single dollar is audited so that you know exactly where your support has been and how it has been spent. We owe this to you. Thanks again. L'Akai, c'est l'Akai, Haïti pas capé. Merci à vous.
Thank you. First, then Paul, the floor is yours.
All right, thank you very much. Good afternoon, everybody. First of all, I'd like to thank you for being with us and for your solidarity with us here in Haiti in these times of extreme challenges and difficulties. What I will try to do in the next 10 minutes maximum is to talk about three aspects of the Commission. As controller of the Commission, I'm trying to give you a little bit of context to add to what Bill had said. So I'll talk about the Commission itself, the planning process and the national integrated plan that we have, and the command center that we have launched. I'll start with the Commission itself. In a nutshell, from the beginning, many partners from civil society, the private sector, and the international community had committed themselves to support Haiti and Haiti's response to the crisis. That certainly represented a huge opportunity to capitalize on for sure. But also, when you have a lot of partners interested with the multiplicity of actors with conflicting priorities, timelines, and agendas, represented a major challenge that called for mechanisms to ensure concerted, coordinated, and synergistic interventions in the context of a unified and orchestrated national strategy. With that in mind, the government of Haiti, the presidency, on April the 3rd, by arrêté présidentiel, created this commission with basically two key roles. The first is to provide strategic guidance and support to the Ministry of Health in the planning and execution of the response. The second is to coordinate resources provided by non-governmental organizations and the private business sector. Now, with advice from the Commission, the Ministry of Health remains responsible for the implementation and is in the lead regarding planning for allocation and use of financial resources from the government of Haiti. The Commission, as you know, is co-presided by Dr. Pape and Dr. Laurie Adrien, who is the Director General of the Ministry of Health, and I am the Controller General of its operations. All of us are volunteers and apolitical. Now, how's the Commission structured? Basically, it has three units. At its core is a command center that I'll talk about a little later, a communication and PR component, and an administration. That administration focuses on technology, financial controls, transparency, and performance management. I'd like to stress three words here: transparency, accountability, and performance management. Why? We at the Commission, we do not want a Corona Caribe, and we also do not want to repeat the experience that we have lived during the response to the earthquake. Lots of interventions, very few results. A final thought about the Commission is that we are trying to make sure that this experience, although very painful, can be used to capitalize on what is happening and to show to ourselves and to our partners that things can be done differently in Haiti, that we Haitians can work together despite our political differences, regardless of political affiliations, etc., and that we can focus on the national priority, leverage each other's skills, capacities, and talent, and achieve important results together, while managing resources efficiently, in full transparency, and in partnership and full synergy with our international partners. We also want to keep a two-pronged approach. Absolutely, there is an urgent need for response right now, but we also want to make sure that whatever we're doing in that response can be leveraged as an opportunity to strengthen the health system in the future, whether this is about equipment, training, and approaches. That's in a nutshell the Commission. The plans. We have two plans, a global integrated national response plan, and a communication strategy and plan. Let me talk a little bit about the plan. A key activity of the Commission early on was to identify and regroup key actors already engaged on the ground to build more of a coalition around a common vision. 1, limit the propagation of the virus, so that's prevention. 3, adequate treatment, and 2, treatment, and 3, testing, sorry. The Commission organized and led national discussions around priorities and facilitate a process to fine-tune and, as needed, reorient partners' plans to be in alignment with Haiti's needs and priorities. We wanted to move from the usual of many, many plans and many, many actors to one national plan, Haitian-led, supported by many partners, not just actors. So we arrived at one plan. There is a one integrated operational plan that is led by Haiti and Haitians. That plan has a budget of $176 million. That sounds like a lot, but believe me, it's nothing. The Dominican Republic is already up to $1.2 billion. Although we are implementing very slowly because of lack of funds, we are started with key areas. 1 is infrastructure and case management. 2, communication for behavior change and community mobilization. 3, supply chain. And 4, epidemiological surveillance and labs. These are the 4 components of the plan. The plan clearly indicates what group, organization, or agencies are leading the different components and what the deliverables are expected to be. In terms of budget, like Bill mentioned, what we have had so far has been from the government. We have been about $20 million from the government in procurement of equipment. We are very grateful for that because that's basically most of what we have is equipment. We have received 6 Boeing 747 with equipment from different places. So we have 3 depot warehouses at Sonapi that are full. With support of the private sector, we have started and will complete on Sunday distribution of equipment to all 10 geographic departments. That has been totally a contribution of the private sector, not $1 from the international community or the government. We also have, I have to say that today we have 14 sites that are functional throughout the country, and a little bit more than the 200 beds. We had 466 COVID beds available throughout the country. The second plan is the communication plan. This is a major, major challenge for all the reasons that Dr. Papp mentioned. As you know, a lot of people still don't believe that this is true. They think it's a Jovenel disease. This is to make money. People are not respecting the guidelines, even though now they're beginning to panic because now they're feeling what it feels like. So we had 7 volunteer Haitian communication experts work together for 3 weeks, day and night, to develop a superb communication and community mobilization plan. This is a $7 million plan, which really is nothing. It's less than 50 cents per person. We have started the launch of this plan. This is the top priority because we have to slow down that propagation. We have only 300,000 of the 7 million to launch the plan. So that's an area where folks that are interested to support can help. The document pulls together 4 communication strategies that were floating around, 2 from the Ministry of Health, 1 from the Prime Minister's office, and another 1 from the Ministry of Communication and Culture. All these have been put together in an integrated and really well-developed national plan. We also have a cluster of communication that regroups about 20 professionals, all volunteers. So that's very, very important. That's something that we're looking for support to launch. The last I'll talk about is the command center. In partnership with the Ministry of Public Health, the Directorate of Civil Protection, la Protection Civile, members of civil society, and technical assistance from the UN and OCHA, the Commission has put in place a salle de crise, a command center. That salle de crise is hosted at the Montana Hotel with the great support from that hotel, from Access Haiti and others, again, private sector. This is the central location from which the response is managed and all the logistics is organized. It is staffed by coordinators from the Ministry of Health, complemented by our friends from the UN and people from private sector and civil society. It's organized around 5 cells that mirrors the national plan. That's basically infrastructure, setting up the sites, case management, meaning prise en charge of patients, communication, logistics, and communication, logistic, and labs, and surveillance. That's the group that's working every day to coordinate, plan, and inform, and pulls together all the information that goes to the decision makers at the end of the day. We are launching, hopefully this weekend, a website to help with the transparency and ensuring that information is shared. But more than that, we want information to be accurate. There is a lot of rumor, there's a lot of nonsensical things going on, a lot of it having to do with ignorance, others having to do with competing agendas and political agendas. And we need to be able to balance that a little bit. A key goal of the crisis room or salle de crise is to promote and maintain a sense of urgency to plan, coordinate, act, and inform. I know that's a lot of information, but I just wanted to give you some context. If I can summarize things that are really good that we're seeing and some of the challenges. One, we are seeing that, yes, we can do things differently. Even though we're working with our nails, basically so far, a lot has been done. There are 14 sites operating and functional throughout the country. Equipment have been distributed throughout the country without $1 from the international community and without $1 from the government, for that matter. The resilience of Haiti and Haitians come through so superbly in this effort. The massive talent that is untapped that we are seeing, especially young people in the Ministry of Health that have really come forward to help this move. The problems, for some reason, we cannot create a sense of urgency everywhere. A lot of things work, even though the government is helping. As you know, it takes a lot of time to move that machine. The sense of urgency is basically not there. Also, the government, as you know, is not credible. So that's created a big challenge for us in terms of communication, because the people talking are people don't believe in. So now we have to kind of catch up with the new communication plan to really provide the right message and move people in the right direction. Bill talked about insecurity. As we're trying to go with messages, you have to fight how to get there and be safe. For example, as we're launching sites, like we're launching one today, a big part of the strategy and money from the private sector is helping us manage gangs around the site and to make sure the sites are protected. There is a huge problem of violence and threats to the sites, as well as to COVID positive people. Promise versus reality. We have inventoried $300 million of promises to Haiti. Many of them from our good friends and partners in the press, in press conferences, etc. I have to say not $1 of that $300 million has arrived at the commission door. In terms of how much money we are talking right now, in a $176 million budget, we are discussing with some multilateral organization for a total that does not reach 50 million, 50. And that money, if everything goes well and the accelerated processes that they're putting in place function, it will arrive in 8 to 10 weeks. I hope that we won't need it by then, because either we would have been successful or everybody's dead. So that sounds terrible, but that's the reality. The government has really contributed with about $20 million of equipment. After that, we have not received $1 from the government, not even from the functioning of the rooms or the commission itself. Everything that we have so far has been the private sector. And I really would like to thank the Hotel Montana, Access Haiti, NatCom, Digicel, and some of those that show that we can do it together. And most importantly, we can do it, especially when we are working in full transparency and trust is established at the top. So that was my spiel to you to give you a bit of context of what we've gone through. It's a great experience, but a very stressful one, I can tell you that.
Well, thank you so much. Then we would move to Dr. Ouzier, if you don't mind.
Well, thank you, everybody. Thank you for joining us this afternoon and for giving us the opportunity to talk about what's going on the ground. So thank you, Paul, for a really nice, succinct presentation of a lot of hard work. I know it sounds clear in words, but it's not that simple. Friends in Haiti and our Haitian friends abroad know that getting things coordinated in Haiti can be a challenge. So I just want to say a great bravo to the team at the Commission for their selfless leadership. I know it's not easy. So I'm going to talk briefly to you about what's been done so far on the ground on the clinical point of view in terms of prevention, testing, and care. So as was said in the presentation, I'm at the JESCO centers located downtown across from the violent gangs in the slums. And I can testify to what Paul was talking about, the violence. That's certainly a big challenge in what we do. So what have we done in terms of prevention, testing, and providing care for COVID patients at JESCO so far? So prevention started even before we had our first cases identified in Haiti. We set up to start promulgating prevention messages, and we implemented prevention treatment strategies at JESCO. So we have about 1,500 patients that's come to the center on a daily basis. So for us, it was an opportunity to start educating the population about how to prevent catching COVID, which is our greatest arm, because we know that treatment facilities are going to be a challenge in Haiti. So we started since early March. We dressed up hand washing stations throughout the campuses, and we promoted that with partnering hospitals and public sector. We started telling people to set up hand washing stations. We started manufacturing masks, so cloth masks that all JESCO employees were required to start wearing, really as a way to start getting people to believing in prevention messages. We would distribute masks to all the patients that would come to the center to seek care, and we would give them to go home as well and encourage their families to go home and use those prevention messages. And then early on, even before testing became available, we implemented a screening questionnaire at JESCO because we knew that it would take a bit of time for tests to become available. So we started asking people about travel-related contact with anybody with COVID, and signs and symptoms of COVID. We've distributed that questionnaire broadly so that all clinics could start monitoring, because we wanted to be ready to identify when the first suspicious cases of COVID could come, so we could take appropriate isolation measures. We made sure that infection control procedures were revisited at the site to make sure that our personnel was protected, and that what needed to be done to make sure that the rooms were open and aerated was implemented so that our healthcare personnel could be protected and feel safe. We also immediately started working with community leaders, because that is an essential pillar to anything that we do in Haiti. If the community doesn't feel engaged and does not have the trust of the local providers, then nothing really gets to be done. So we had meetings with community leaders. We set up training modules with them. We identified and hired about 1,000 community health agents that received different training modules on what the signs and symptoms of COVID were, what the prevention messages were, and how they could address the myths surrounding COVID. This is really important because community agents are highly respected in their different communities, and this is important that even before we set up a treatment center, that the community was informed about what this new disease was, what they could do to prevent catching it, and that this was coming from a credible source. So early surveillance allowed us to really get our patients used to receiving the questioning and really hearing about what the COVID signs and symptoms were to help them prepare mentally for this disease. In terms of testing, JESCO and the National Lab are the only two laboratory centers in the country that have capacity to run the recommended test, which is the PCR-based test. For those of you who know, PCR-based technology is very laborious and tedious. And because JESCO participates in NIH-funded trials and we have external validated protocols, this enables us to participate with the national lab in the testing capacity. Everything that we do is shared with the Ministry of Health through the national lab. So all the tests that were ordered and bought with money from the private sector and from the government is shared equally, so that those two labs are responsible for testing for the whole country. So specimens are collected and sent to both labs, and results are reported through the surveillance sector of the Ministry of Health. Now, there is a plan as well to increase testing and provide access to rural areas using the tuberculosis platform that we have in Haiti that has what is called the Gene Expert testing platform in all 10 departments in Haiti, so that we will be able to provide decentralized access to testing. It's been slow in scaling up, because really there's been a ban in the US selling the Gene Expert reagents outside of the US. So that is some of the challenges that we are dealing with as well. Now that we are in the surge of the epidemic, we're going to be moving towards a clinical case definition of COVID, as testing capacity has become quickly overwhelmed, as many patients are presenting with the typical signs and symptoms. Testing is going to be prioritized for healthcare workers, essential service workers, and really high-risk people, and contacts that we can isolate to try to curb the spread of the virus. In terms of the National Care Plan, Paul really described beautifully what has been done, and I think it's truly remarkable that for the first time we have a one plan, one agenda nationally. And it was hard to push, and I congratulate them for that. But the plan is really simple. We're a resource limited setting. We're not gonna have tremendous ICU capacity. The idea is to really have level 1 and level 2 basic hospital care that can save as many people as possible. As you know, the Haitian population, fortunately, is much younger than our US population, Spain and Italy, where the mortality was very high in the older age groups. So we're hoping that by providing basic care, which consists of early detection of a need for oxygen, by providing oxygen, IV fluids, and basic treatment for comorbidities such as hypertension and diabetes, which COVID can precipitate a diabetic patient being very unwell. We're hoping that being able to provide basic care at those centers will be able to save the majority of people. We're thrilled to have at least 14 sites already set up and running. We have 2 treatment centers at both GESCO campuses with 50-bed capacities. Now, the challenge is really to get people to come early. What we've seen so far in the beginning of this epidemic is that people are presenting really in extremis when they've been homesick for a long time. So the communication strategy really is an urgent matter. We really need people to really believe that this is going on, and to encourage them to seek care early so we can provide those life-saving interventions, which are available, which is simple, which is not difficult to do. Provide oxygen, provide IV fluids, provide care for hypertension and diabetes so that people who have those comorbidities can be treated safely. And I want to give you a bit of the numbers of what we're seeing. On May 8th in Haiti, we had 150 cases that were confirmed. 8 days later, on May 16th, we had 456 cases confirmed. And on May 26th, we're at 1,174 cases confirmed. So we're really in the exponential phase of the epidemic. People everywhere are symptomatic. The numbers that have been tested are really a small, the tip of the iceberg of really what's going on. There's massive community spread, and there's still a lot of myth and a lot of disbelief. So there's a lot of work that needs to be done to really engage the community so that they feel like they can access the care that they deserve. I want to touch upon the point that Paul mentioned about the work that's being done with community agents as well. I think this is crucial. This is important with the communication plan, because there is that political agenda and people don't trust messages that come from the government. We really want people to understand that they can trust, obviously, people from their community, and they can access the centers. We've all seen in the press that some of the treatment centers or the testing sites that were set up have been ransacked or burned down. Community trust is obviously very important for that. We have treatment guidelines that have been developed for in-hospital care, and we're also preparing in-home, at-home treatment guidelines, as a majority of the population so far will have the mild cases, mild symptoms, and can be managed at home. And then finally, what have we done in terms of protecting our healthcare workers? As you know, nurses and doctors working on the front line are obviously much more exposed, as well as their families. So we've trained over 500 physicians and nurses. We've also filmed those training sessions so that they are available on YouTube and on other electronic platforms, and that we will be using that to disseminate nationally so that more people can receive the training that they need. And the training really covers everything from what is COVID-19, how is it transmitted, what are the prevention methods, how to protect personnel with putting on and taking off protective equipment. It covers basic care for sick patients in hospital and at home. And we have a specific video on how to set up oxygen therapy as well. I'm going to stop here, and I hope this has covered what we've done. And I think Dr. Inote is going to be presenting what's been done in the rural areas. Thank you.
Thank you, Dr. Ouzier. I'd like to pass the mic to Dr. Inobel Pierre. Dr. Pierre, thanks.
Hi, everybody. So I want to start by thanking all our partners on the panel, Kellogg Foundation, and every partner for this wonderful opportunity to talk about what we've been doing since actually, yes, mid-January. Yes, so the challenges that we're facing in the Fond-des-Blancs area are not very different from what Dr. Ouzier just described. So starting in end of January, when we first held our meeting on COVID-19, so we've been trying to address those challenges. We knew it wasn't going to be easy, but we took it up to make sure that we save as many lives as possible. So end of January, the first thing that we decided that we would do was to train our staff on what was available at the time as knowledge on COVID-19. So hand washing, the way to don and doff PPEs, the clinical signs and symptoms, and everything that we could get on hand at that time. So we made sure that we shared them with our staff. And actually, we kept doing this kind of training for our staff on a regular basis, because we knew it was just a matter of time that the pandemic would come to our way. Anyway, it wasn't declared a pandemic yet, but we knew at the rate it was spreading to many countries that it would probably come to our borders. And so what we did, we reinforced our training for our staff, but at the same time also, we set up meetings with the community leaders. In Fond-des-Blancs, there are many gagueres, places where people would gather. We met with the pastors, with the priests, with the teachers, school directors, any community leader. We made sure that we get them the message and advise them to sort of share it with the community. Early on, we understood also there was a big problem of fear, which actually led very early on also to stigma. And people, for example, the first cases when they appeared, so were not very well welcomed. And people actually were seeing anyone infected with COVID-19 as deserving death. So we know about it. So we also knew that it was a question of education. So we worked on it. We can't say by now that it's all addressed, because it's hard to get those bad habits away from people. But we've seen very encouraging signs of acceptance of the disease by the community. But we know that we still have a lot of work to do. So 1 week after the first case was announced on national TV by the president, so we diagnosed a suspected case also at our hospital. So it came from a neighboring region called Miracuan. Unfortunately, we haven't been able to keep that patient because of stigma. He was so scared for his life. We tried to keep him and get him tested by the MSPP, but he didn't want to stay. So actually he left, but he was, after 2-3 days later, he was tested and turned to be positive. And since then, actually, we've been working on getting ready. In April, we decided that we would build a separate space to keep the suspected cases and also the confirmed cases, when actually we have the capacity to confirm cases. So right now we have those 2 buildings ready, and they can accommodate about 50 patients. So in the meantime, we've been setting up triage. We have a team that triage patients from the gate every day. Actually, it's 24/7, and we make sure that nobody actually gets through it, because we want at much as possible to protect not only the patients, the regular patients that we have at the hospital, but also our staff and the community. So it's been there, and we have a circuit for our patients. And so far, we've got 27 suspected cases. And out of those 27 suspected cases, so we've been able to get 21 tested. So for some, actually, we've never been able to get the result. Actually, too long. Sometimes more than 10 days for the result to be turned in. But actually, right now, we have our staff working at full capacity. We have currently 8 suspected cases. The main challenge that we have right now, besides addressing the educative aspect of the community, is mostly testing, because testing is a real issue, and because we can't do any tests, so it's hard to make quick decisions, and those quick decisions actually are very helpful in protecting the staff, protecting the community, and starting treatment as early as possible. But we've been learning from the COVID-19, and the staff morale is very good at this point, because with the support of partners from the US who've been through the pandemic before us and shared their lessons with us, we've been able to anticipate some issues, address them in a timely manner, and make sure that we share them with our staff and also the community. So as we speak, we have teams on the ground working 24/7 in the unit. But as we said, we're really contemplating the capacity to test people. Just side note, we had a gene expert, but it's been to the national lab for about a year, almost a year now, and it's never been given back to us. So we think that with the gene expert, we could probably try to get the cartridges and do a better job at not only diagnosing, but also protecting both our staff, our patients at the hospital, but also the community. That's all I have. Thank you.
Thank you, Dr. Pierre. Really appreciate your thoughts. And I just want to remind everybody to use the chat function just in case you have any questions for the panelists, and we'll quickly move to a Q&A. But before we do, I was asked to sort of describe what the role of philanthropy could be in a crisis like COVID-19. Basically, the audience being philanthropists themselves and wanting to help, just wanted to note a few things. First of all, that this crisis is unprecedented in scale and impact. And virtually every community around the world is being impacted right now. For the first time, Haiti is not unique in this crisis. But countries like Haiti have a vulnerability in responding to this crisis because of the colonial, racialized, unequal, and systemic issues that we have known about for decades now. The second thing I would like to note is that philanthropies also have a very unique advantage in this crisis. Local as well as international funders and donors have the ability to work flexibly to rise to the challenge, but they can also work in partnership, in collaboration with local governments, national governments, private organizations, and civil society. The third important thing to note is that philanthropy is also more than just money, and it's broader than just large gifts from corporations and foundations. In fact, in this moment, we're seeing communities of color in the U.S. as not just recipients of philanthropy, but also important donors working to meet the needs of their vulnerable neighbors in the community. In the case of Haiti, one of the silver linings of this crisis has been to see local philanthropic partners step up in the face of the many challenges Haiti is facing with COVID-19. In fact, the local philanthropic response has been quite strong, as Paul just mentioned, with a great number of individual gifts from the private sector and civil society rushing in to support private hospitals, the National Task Force, and the Haitian government's response to COVID-19 in Haiti. We're also seeing great Haitian ingenuity, creativity, and innovation in the way private organizations are responding to the crisis. From local organizations and businesses coming together as a network to produce locally made masks, gowns, and other products for healthcare personnel, to artists in Haiti and in the diaspora hosting virtual fundraisers, to rum producers and manufacturers in Haiti shifting their production line to make hand sanitizers. It's clear that philanthropy is not just within the purview of the wealthy, but extends to a deep sense of community and generosity in this moment. People all over Haiti, across different sectors and very different backgrounds, are mobilizing in very unique ways. Perhaps the crisis could be an inflection point for reigniting the lost tradition of philanthropy in Haiti so that local grassroots organizations like Jescus and Boniface and others can proactively work towards more resilient communities. As for the just brief summary of the response of the Kellogg Foundation, the Haiti team of the Kellogg Foundation has been at the forefront of this crisis from the very beginning, proactively mounting a response with partners and grantees even before the first confirmed cases of COVID-19 were announced in Haiti. Our response has been threefold. First, we spoke directly with our grantees and partners on the ground to know exactly what they needed. We then immediately connected with other funders to invest in collaborative efforts of providing frontline support to communities. We worked directly with our nonprofit grantees to determine what flexibility they also needed from our funding. We developed a set of flexible guidelines and streamlined internal processes in our system so that we can take the pressure off our grantees during this very difficult time. We made sure they could repurpose existing commitments in some cases and even in other cases, giving them additional resources so as to quickly adapt and shift to what they need to do to respond to this crisis. It's clear that we started with relief, but we're now moving towards thinking more about the next year and the several years thereafter, basically the near and long term of the crisis. We know that the majority of philanthropic giving usually goes to organizations that help with immediate emergency assistance, and not enough resources go to preparedness, mitigation, and recovery. That there's a constant tension between how much we can focus on emergency relief now and how much we can support the longer term thinking that allows us to come out of this crisis in a more just and equitable way. The kind of thinking that help address the systemic issues that we have known about for decades. This is a moment for collaboration across all sectors because these problems cannot be fixed by one sector alone. We often talk about a 3-sector solution, with philanthropy having a place at the table to lift up equity concerns, but we also need governments, local and national and private organizations to work in partnership. As a global foundation committed to Haiti for at least a generation, we at the Kellogg Foundation commit to investments in Haiti and to continue supporting grantees and partners that are able to think systemically about big system change issues. This pandemic is historic and unique in our lifetime, and an opportunity to reimagine a new future, a future where our investments can be leveraged to change these systems that were creating these disparities in the first place. Philanthropy can use influence, knowledge, collaboration, and partnership of all of us coming together to make sure our investments in Haiti are not counterproductive. Many of us in this webinar are uniquely well positioned to be active supporters to these organizations. So let's use our collective power and knowledge of disaster response, but also recovery, as to not repeat the mistakes of the past, but create more equitable and resilient communities in Haiti. Thank you, and with that, I would like to move to the Q&A session. The first question actually goes to Paul Oxila. And Paul, if you could quickly tell us, how does the Commission intend to demonstrate to the Haitian people, Haitian government, and international partners that it is using funding appropriately?
Sure. Like I mentioned earlier, we are setting up, or we have set up mechanism for control of the finances, as well as following up on performance. Like I said to the President, I said, Mr. President, we don't want the earthquake situation. We need systems to control the money, even if it's not managed by us. What we're putting in place is that donors, let's say, for example, the World Bank, that is decided to fund UNICEF for part of the communication plan. We work with the World Bank to look at whether UNICEF is the right group to be funded to do that. We also talk about the deliverables expected of UNICEF, even though we're not going to be managing the money. The money will go from the World Bank to UNICEF. But we will have our interactions with UNICEF to see what UNICEF is doing, how it's integrated into the plan, and we will be monitoring the deliverables. That's when we don't manage the money. If we are managing the money, first of all, we don't manage any funds from the government of Haiti. That's the problem for the Ministry of Health to handle. We support the Ministry of Health and give advice. We only manage ourselves money that comes from the private sector and some from the international community if it ever materializes. And to do that, it goes to the FAME Foundation that has been working with GESCIO for a very long time. We have set up mechanism. We have a procedures manual on how the money flows, and we will be audited at the end. We are also setting up a website in the next few days where a lot of the information of what money has come in, where it's going, what's happening will be, as well as all the documents that we have, and what are the groups that are actually funding the response. There's a lot of talk and very little action. So we want to call people on their bluff and have it on the website.
Thank you, Paul. The next one goes to Dr. Wouzier. You mentioned that they may go to a case definition to fill in the gaps in testing for confirmed cases. Will those cases be counted, perhaps in a separate list from confirmed cases, and the numbers shared so that we can better know the extent of the pandemic spread and where the greatest hotspots may be in Haiti?
Definitely, that's a great question. I think everybody is well aware of the testing limitations that everywhere was confronted with in New York, Italy, Spain, during the surge of the epidemic. It's impossible to be able to test everybody. And Haiti is no different. If anything, we have even greater limitations. So I think it's important that we move to clinical case definition. We're working with the Ministry of Health to get them to finalize the clinical case definitions and the reporting criteria. As Paul was saying, sometimes perfect can be the enemy of good. It can be slow to get things to be changed, but we really need to be on our feet, because I think the testing that is being done, the cases that are reported, are really the tip of the iceberg. There's a lot more spread in the community, and moving to clinical case definition is essential. And this is what was done for the cholera outbreak. As you know, in 2010, when we had the cholera epidemic, we had culture confirmation for just sentinel sites, and a few cases as per a protocol were being confirmed, but we were able to capture the magnitude of the outbreak using clinical case definitions for suspects and for deaths as well. I think this is really important, because the mortality is really going to tell us the severity of this outbreak. And Haiti is different, it's going to be very different from the US. And I think it's important that we be able to have that monitoring. So the ministry is aware, and we're in conversations with them. And it's going to be the same reporting mechanism through the epidemiological branch of the ministry. We would have confirmed and suspect clinical case definitions.
Thank you, Dr. Uzi. Quick question from Karen and Sarah. Dr. Pierre, could you clarify your request that the national lab give gene testing capacity to St. Boniface Hospital? What are the factors required to establishing that capacity in the Southern Peninsula? So essentially, how can rural areas access testing? Dr. Pierre? I think you're on mute, Dr. Pierre, or not.
Dr. Pierre, go ahead, please.
Hello? Yes. Okay. So as you know, we are working in a very rural area, Fond-des-Blancs. And right now, the way that we do testing is we call the MSPP. And so they would show up as soon as they can, but it may take like, 1 to 2 days. And they come to our hospital, they collect the samples, and go back to Lekai with them. So from here, from what I've heard is they don't send them to the national lab right away. They would be collecting samples for days until they have like an important batch of samples before they send them to the national lab. This I haven't been able to confirm, but we know that it would be way better for accuracy that the tests are well conserved and are also sent to the national lab as soon as possible. So I think at this point, the solution would go through giving access, decentralizing, the testing capacity. It's, I know not every center is going to be able to run tests, but they may define like hospitals with capacity to be, responsible for a group of hospitals in the same region, and make sure that centers in those rural areas have access to a much closer point of testing. So far, it's been pretty centralized, and I think, as you would all agree, the numbers are way less than they are in reality, and it's mostly because of under-testing. So I think it's mostly to think about ways to at least give to those central hospitals around the country. Maybe, I don't know, we would define 2 or 3 per department, and we provide them with the capacity to do testing. And from there, all those, small hospitals, dispensaries, would get their sample there to do the testing.
Thank you, Dr. Pierre. I want to give Dr. Ouzier or Paul the chance to address that in case you have anything to add.
So Dr. Pierre's comment is very important, that the turnaround time for specimens that are collected in the other departments is very long. It's a long time to get results. It takes a long time for the teams to be able to go. There is a plan to use what I was describing, the Gene Expert platforms, which are machines that are used for TB testing, which are available in all departments in the country. There's been slow setting that plan together because we've had a hard time, the National Lab has had a hard time getting access to the reagents. As I said earlier, the US has had a ban on selling certain reagents outside of the US to prioritize those reagents being available to their constituents. And as we said, Haiti is not dealing by itself this epidemic, obviously the whole world. And because we're such a small country and we don't produce these reagents, we're dependent on the international community being able to buy them. We're getting donations from the international community. And the immediate challenge with the Gene Expert cartridges has been that they are not available. We've really lobbied, even through the US Embassy, and the initial request for 5,000 to be purchased, we received 500. So just to give you an idea of being a small country that has very limited power and having access to testing reagents outside. And it's been the same issue with PPE. And this is why it's even more remarkable that the government was able to purchase equipment like Monsieur Balexila told us. There has been greater challenges with testing. So that's why, while we're making some progress, we're hopeful that this will come to pass. Hopefully not too late, not when it's done with the outbreak. But I think this is another critical reason why, Dr. Pierre, we need to move to clinical case definitions so we can account for these people and say, this is very likely to be COVID suspect. We will treat them in our dedicated COVID units so you can protect the population by having a space where you can safely provide them care and that your personnel knows that they are fully protected when they are working. We are a poor country, we have to adapt, and this is gonna be important while we remain very hopeful that we'll be able to provide access to Gene Expert. It would be formidable and different local, we could have testing hubs, as Dr. Pierre described, where one central testing lab could receive from the neighboring hospitals. And that would facilitate a faster turnaround to get the results and really provide evidence for the local communities that these patients were tested, it is confirmed we do have COVID in those communities. I think this is very important.
Thank you, Dr. Ouzier. You did mention that there are already 14 sites up and running. We have a question here asking, where are these available COVID beds? Is there any specific hospitals in different departments that have been designated for COVID care?
So I will make an adjustment and I'll ask Paul to make a comment as well. It's interesting, I'll start with the conflicting information. The government deliberately did not announce on the radio what the COVID treatment centers were because of the stigmatization and because they got burned down. As you saw what happened in the Gonaïves and other places, the community was too afraid to receive COVID treatment centers that up until now, the names have not been distributed widely. So we're hopeful that with the launch of the better communication strategy, that the population becomes acceptant of the reality that COVID is here, that they can access care in a safe manner, that it will become more public. But in Port-au-Prince, so in the West Department, there are the larger COVID centers. There's going to be one, the large one that's going to be opening today is one in Canal. It's the sports complex that was converted to be this huge COVID treatment center that can provide, correct me if I'm wrong, Paul, but I think it's 600 beds. There's going to be another sports complex that is being converted in Carrefour, and there's multiple hospitals. Now, we've also worked, while these sports complexes have been converted to be large COVID centers, what has been key is engaging with all public and private hospitals to get them to have their own COVID units. I think it was important to get healthcare workers and institutions to understand that COVID is everywhere and every hospital needs to prepare. Every hospital needs to have a triage center. Every hospital needs to be able to isolate suspects from other patients coming to the treatment centers. We can't forget that in such desperate times as pandemics, the vulnerable are going to suffer. There are children with malnutrition. Children need to have access to vaccination programs. Pregnant women need to deliver in a safe setting. We cannot close down essential services. We have to maintain essential services. Patients with TB, patients with HIV need to be able to come in for their treatment. So an important aspect of the strategy was really to work with local institutions to get them to prepare by having a triage and a dedicated isolation treatment center, whether or not we had access to testing. This is important to protect the healthcare workers and as well to preserve essential services. Paul, do you want to comment on the list of hospitals?
No, I think you said it quite well. That has been one of the challenges for the commission. When we started, we did not have the list of sites. And that was the first complaint we received from the representative of the Secretary General of the UN, that they had been asking for 2 months. And frankly, there was this issue of security, but there was also a lack of consensus within the Ministry of Health. So it took a little time to come to an agreement with, and we facilitated and brokered that discussion with them and the UN and WHO. And there is a list of approved Government of Haiti sites. There are about 42 of them that are supposed to be opened. And this is going to be little by little because we don't have all the resources and we need to support the implementation of those sites. So the 14 sites it's a combination of, like, the 2 GESCU sites are included in those 14. So it's a list from the command center. That's why I finally got that information 2 days ago, that we have 466 beds and 14 sites. I was surprised. I thought we had like 3. So that was good news, but we have a long, long way to go.
Thank you so much. I have a question. We have a question here. How much does it cost to be tested right now in Haiti, both on the patient side, but also for the government? I would love to hear how much it costs the government too. I was in a conversation a couple of days ago, the cost of, what it costs the government when you take the test and taking the test, giving the result, blah, blah, blah. It's about $100 US per test as a cost to the government and its partners. And I don't know if you want to comment.
I'm going to add that patients are not paying. We're not asking for patients to pay for the test. Obviously, not affordable.
Do we know what the effect of immigration and travel from the DR, and we've seen a lot of reports lately of massive deportations from the US and other hotspots are having on transmissions in Haiti, and what exactly are we doing to sort of mitigate?
Yes, so it's a great question. Haiti was very proactive in shutting down the borders when we had the first 2 cases that were confirmed on March 19th. And if you look at the cases confirmed, the curve of cases confirmed, there was a big lull from March 19th when all the airports were closed to May 8th when we started to see an increase. And I think largely was because we were able to control the transmission from imported cases. The government did a relatively good job. I think we should congratulate them on saying that they closed the airports. There was airport screening that was done. People were being asked to be put on quarantine, and testing was being done for symptomatic patients, people who were coming back from travel. I think this really helped us control the spread early on and allowed us time to prepare, set up the commission. But the challenge has been with the Dominican border. As you know, it's a very porous border. And while there are 4 official crossing points, I think the government lists that there's over 296 unofficial crossing points with the Dominican Republic. And it's been estimated from the OIM, the migration branch of the UN, that there's about 30,000 Haitian that have come back from the DR since then. And we believe this is what has spread, ignited really the community spread and transmission and the exponential cases that we are seeing currently. Because people that came back from the DR really moved back to all of the 10 departments in the country. And the DR had transmission that was very ongoing at the time. And the big challenge is to control the border. It's not going to be possible to have a tight control, but we are setting up help at the border to increase screening, triage, and isolation of symptomatic cases. But we're beyond that. The epidemic is really rip-roaring at this point, but it has contributed. And the last point I will say, it's really terrible that the US is sending back deportees without testing them. And we've had many that have tested positive when coming back from those deportation flights. There's been grassroots outrage and letters that have been written to ask the US to stop this. And maybe this is something that our friends in the diaspora can say as well. You are in a resource-rich setting and you are sending somebody to a resource-poor setting when they are positive for COVID and they might not even be able to access care and they might die. This is really, really not ethical.
Thank you, Dr. Uze. I guess the last 2 questions we want to ask are around broadly philanthropy, right? And how can it be continued to be fostered to transparently strengthen the public health infrastructure in Haiti and strengthen health systems in that same country? Paul, maybe you want to take a stab at that?
I think, like we were saying earlier, we're trying as much as we can. You know, for example, when people say the plan is expensive, but what people have to realize that, like I usually say, quote unquote, in a normal country, there are things we would not need to buy. There's a lot of equipment that, for example, we needed just because as a country, we don't have them. So we have to kind of step up there and then build on that for COVID. So in a way, for example, we have been able to get 17 oxygen generators. So that's going to stay for the country. You know, so we are looking at how do we make sure that what we get, we have the training, we have the infrastructure, blah, 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 to then repurpose this later for strengthening the health system. I think in terms of philanthropy, like you said, what we are looking is not just money, but partners and collaboration. There is a plan. It's going to be on the website. If anybody contact me and is interested to look at some of the details on some of it, I'm happy to share that. And I'll give you some example because sometimes people say, it's so much, what do we do? And I'll give you examples of areas where it got stuck and you would not believe. In some areas, for example, the site we're trying to reopen today, we realized, okay, there is a problem to develop a bassin, I forgot the word in English, for disinfection of the PPEs, the washable PPEs. And we were like, okay, how do we do it? Call Ministry of Health, no money. Call France, call this, call that. This is a simple thing in any normal operation. Son bassin, okay. So that somebody could say, okay, let me do the bassin, for example. I'll give you another example. We get stuck for a truck, bringing some equipment sometimes. Phone cards from people. I'm talking very basics, you know. For example, we have the communication plan. There are very specific activities in the plan. Somebody might say, well, you know, I'm interested in communication. Let me do this, let me do that. That's not what we need. What we need is somebody to say, let me see the plan. Okay, these are areas I can contribute either by my skill or with money or within a partnership, etc. So what we have is we have something people can focus on so we can be effective working together. Now, we have to repurpose a lot of sites. Some of them are brand new, some of them are really, you know, schools, gymnasium, etc. So there are lots of things that need to happen in all of these sites. And some people might say, you know what, I know how to do disinfection. I can give you 2 generators. I can give you phone cards. I can help the people going to the field with transport. So it's not necessarily all kinds of big $1 million program we're looking for. We're looking for partners that can look at the plans and say, I can help with that. And I can partner with you on that.
Thank you. We have a question here around the YouTube video for healthcare workers. Dr. Ouzier, can you tell us what the title of that was and if it's available and accessible to anyone?
It's on JESCO's website, but maybe I'll share the link. It's not obvious to find on the website, so I'll share the link, and if you can disseminate, that'd be great.
Can I just ask the panelists if there's an avenue where the audience can sort of connect with you on, and maybe you want to just share what you're thinking about in terms of, for example, Paul with the National Task Force. Who do they connect with? Do they contact you, or are you going to share your information with everybody?
Yeah, I put my email on the chat already. The website will be on in the next few days, and documents will be there. I mean, and if there is something that's not there, I mean, like I said, there's nothing that should be a secret about this. So everything that we can put on there will be on there. Okay. But if it's not and people have questions, they can definitely write to me or call me. I mean, we're available.
Dr. Ouzier and JESCO and Dr. Pierre.
Yeah, so I just put my email address there as well. And I saw a couple of people in the group chat said that they have community groups that they'd be willing to either share the curriculum or help engage. This is wonderful. This is what we hope to get out of this. So please contact me. I don't know if everybody can see my email address, and we'll be happy to share what we have. This is really an opportunity for us to reach as much as possible, and we're happy to do it with local partners that are trusted in their areas.
Thank you. Dr. Pierre, you want to maybe tell us how people can sort of learn more about St. Boniface's plans around COVID-19?
Yes, so actually I also put my the foundation website. So anyone who really needs to get more information on how to contribute and help the hospital with coping with the infection, so they can contact us on the website, and we will share all the information that we have on this. Thank you.
Thank you. We have another question. What is the collaboration between the public and the private hospitals looking like right now around COVID-19 response in Haiti?
At the commission early on, we had a lot of conversation with the Association of Private Hospitals. The initial idea was, when we thought we were going to have more resources, was to develop a partnership with them and some kind of a performance-based agreement where we were going to have a cost per patient. Unfortunately, the proposal was very high and we were not able to reach an agreement. But the collaboration is very good. For example, Dr. Papp from JESCO collaborated with WHO to look at the triage, because at the beginning they were discussing, well, we're not going to get involved, blah, blah, blah. And what Dr. Papp convinced them of is, whether you like it or not, you're going to be involved. And now they are seeing it. So what the commission is doing, and the ministry in partnership with WHO, is helping them in terms of developing capacity, training. JESCO also has been incredibly useful and effective, helping in the training of other hospitals. With WHO and the ministry, we are having orientations for them on triage capacity, triage protocols, etc. So the collaboration is very good.
I will stress on Paul's point that I think people were isolating themselves, thinking that, okay, there's going to be COVID treatment centers. I don't have to be part, I can stay away. But it's impossible. Obviously, with this amount of community spread, there's COVID everywhere. It's in the supermarket, it's in the marché, it's in the bank. So I think now the private sector is really more actively participating, understanding that this is a must.
Yeah, and one thing that Dr. Ouzier said that reminds me of it, what we're also seeing is paralysis in some areas. For example, there are several bank succursal branches that have closed. There are sections of the UN that have closed. There are parts of the Ministry of Health that have closed. They are part of the national labs that had people in quarantine. So this is becoming very, very visible, and it will exacerbate some of the other issues that Dr. Pap talked about, economy and things like that. Because a lot of places are really becoming a little bit dysfunctional and paralyzed.
Yes.
Thank you. I just want to remind the audience that we know that some of the panelists' contact information did not reach you. So we'll make sure to follow up with everybody who has registered and share that information with you as possible. So we're already out of time. I want to thank all of our fantastic speakers for taking the time with us today, and also HDI for hosting this very important and timely webinar. Thank you again for joining us, and I will just turn it over to Pierre for joining us. Thank you so much.
Thank you, Ryan, and I want to say again, thank you to everyone for joining us. Really, you've shared a ton of information with us here. To everyone else, we will be sharing and sending this recording, and also we have the information in the chat that we will curate and share also with you. If you did not provide us information specifically, or your email, you can reach out to us at HDI, and we will share that with you as well. This is a ton of very helpful information, and we definitely will follow up on that. I want to thank all of our 4 speakers. You have shared a lot with us, and this has been an honest and fruitful conversation, and we look forward to next steps on this. I also want to say how happy I am to hear that the role that local philanthropy has been playing in this. Really being in philanthropy over the last decade, I think there is one thing that's always somewhat eluded us, is that actually that central role that philanthropy can play in Haiti. And I think moving forward, I would go back to what Paul said, is how do we think about harnessing what we're learning right now for the future, and how do we place, I hear a lot also about local leaders, community leaders, the role they're playing in this, in accompanying their communities. So to me, these are things that we want, we at HDI really look forward to deepening conversation about, and seeing how we really come out of this on the other side, having learned from it. Certainly the months of the lock that preceded the COVID has created grave challenges for us all. I think when you look at the crisis, the economy, you look at the healthcare crisis, the education, the children have lost a full year, and families on the agriculture have lost livelihoods. So we really need to brace to deal with a lot, and we're just weeks away from a hurricane season as well. So I would definitely implore you to look at what it is, how we can support the work, the plan. Again, I can't say enough. There is a national plan, and I am happy that Paul has also mentioned that alignment is key. We are all working to support and avoid a major crisis, avoid death in the Haitian community across Haiti. So alignment, collaboration, definitely I would be important. Equitable access to, and also fair allocation of resources, but also solutions that really are suitable for our context will also be important. And in closing, I simply would pray that we'll find the fortitude and will to fight this challenges that we're facing, but relying on principles or values of solidarity, collaboration, and unity, and partnership. These are the best should be we're all working toward building communities and building with the Haitian, with Haitian leadership. So thank you, and we look forward to share all that we have collected in terms of information with you in the next few days. Thank you very much. Thank you again for all the panels and for all of you who have participated and listened in. Thank you. And this is, we're in this together. Kimby Film.